Welcome back. We're talking about panic attacks, panic disorders. You can ask your questions about the disorder if you use this number, 0808-054-2233. That's 0808-054-2233. And you can always tweet at CTV_Mary A while we continue the conversation. Now you said no warning signals.
Yeah.
It just comes.
Yeah.
I can imagine how such a person would be scared of the next occurrence.
Literally frightened. Literally frightened.
Okay, so are there any self-help tips for people going through a panic disorder or a panic attack? Or is it something that is completely out of their league?
Well, the first self-help tip will be to be informed, because there is a great relief anyone experiences when they know what they are dealing with, knowing the fact that it is uncomfortable but not life-threatening. So that's like where everything starts. Then there are relaxation techniques.
Okay.
Because during a panic attack, one of the things that people struggle with is their breath. And because they are struggling with that, it's actually worsening the situation. So one of the things we do is teach them how to do the deep breathing exercise. So it's advised that you should practice them before you have a panic attack, so that when you have a panic attack, you
know exactly what to do.
Exactly. So, and once you engage in that, most times it goes a long way helping. And another thing too is to deal with the anticipation. You know, I like to put it this way, that it's like a bully. You know, if you have a bully that comes once in a while to disturb you, you are constantly panicking, you're afraid that the bully will come. But if you walk towards the bully and say, I am here for you, you know, the bully is going to get scared.
So in other words, face the fear.
Exactly.
But since it's such a real fear, is there a way of sort of reducing the, how do I put it, reducing the scare factor of the fear?
Yeah.
Like attenuating it.
The fact is that your fear is fed by your thoughts.
Okay.
So the treatment is to teach people that there is an association between your thoughts and the worsening of the symptoms.
Okay.
So I feel something in my body. It's real. I'm feeling a discomfort in my body. But my mind says, maybe this is a sign of my heart failing. My mind, that's what I tell myself.
Yes.
So I get more aggravated. That was the panic loop we're looking at earlier. So I get more aggravated, and because I get more aggravated, the symptom seems bigger than it truly is. So the meaning I'm giving to that symptom is what is worsening my experience. So when people learn to catch their thoughts and address their thoughts, that means talk back to themselves and say, it's just a symptom, no biggie, and all that. It has a way that it
lessens it.
Yes, it lessens.
Let's take this call from Akim. Hello, Akim.
Hello.
Good day, Akim. What's your question?
I thank you for the program I heard this morning, because it's like what I'm seeing in my own body, so which is my doctor that there has explained about it, that the symptoms that we see, but sometimes I'm feeling that my chest is spinning. So, in fact, when I'm getting it, I have to wake up now to go to the hospital because as I hear it, I appreciate it. So I just want to thank for the.
Thank you so much, Akim. We appreciate it. Yeah. So that's Akim saying that he knows now that he can go to the hospital. Now, Hadiza is saying on Twitter, she says the GP is the first line of contact, and then the patient is referred to a psychiatrist or psychologist. Is that correct?
Yeah, that's very correct.
Okay, so people are really getting it. When do panic attacks start in life?
Usually it starts in late teens and early 20s. But that's when it usually starts.
Is that because younger people don't have such anxieties?
If anything, younger people have a lot of anxieties. If anything, they do. But it could also occur at any time of life. Okay. So somebody could have lived up to his 50s, 60s, never experienced a panic attack or a panic disorder, and begin to experience it in their 60s. So it could occur at any point, but it's usually, but most times it is most diagnosed. That's when people come to the hospital, or finally having gone to several places, it's most diagnosed between the ages of 30 to 50. But it will start in, in their early 20s or in their late teens.
If a person doesn't eventually see a doctor, or at least doesn't see the psychiatrist, and is not properly diagnosed, what happens to that person with repeated attacks?
Okay, well, with repeated attacks, it has a profound effect on several things, because, for example, one who struggles with that will constantly live with a fear of, having that situation. So that fear in itself it reduces one's quality of life. Secondly, that individual will keep going to the hospital for various, do this test, do that test. So financially, the person is spending a lot of money trying to look for a cure. Yeah, travel to various places looking for a cure, whereas it's just a panic attack. Then of course it's going to impact on how the person functions in terms of family, work, and all that. There may be some level of avoidance. I know someone who had to stop a particular job and went for,
because of these attacks.
Yes, exactly. So there are many factors when proper treatment is many effects. When proper treatment is not sought.
We're getting a call from Morrison. Hello, Morrison.
Hello, good afternoon.
Good afternoon. What's your question?
My question is there a relationship between this panic attack and heart attack?
And heart attack, okay.
Heart attack. Thank you, Morrison.
Okay.
Thank you.
Okay. Thank you, Morrison. That's a fantastic question. Like I earlier said, that they are very similar in their presentation. So I would first of all say that it is best you go to the hospital and not make a self-diagnosis.
So they will do the elimination process themselves?
Yes, because they will have to eliminate that there's nothing going on in your heart before they, now conclude that perhaps you're having a panic attack.
Is this a curable condition?
Yes. First of all, the thing is that some people have it and it resolves spontaneously. So that's without any form of treatment. It comes on, it goes, and after a while, some people just say, I don't experience those things anymore. As far as treatment is concerned, the major forms of treatment it's a combination. It could be a combination or standalone of medications and or therapy, talk therapy. The therapy that is used is called the cognitive behavioral therapy.
So essentially, you just discuss with the patient and the patient is cured?
Yes. That sounds very simple.
It sounds so simple.
But it is. It is exactly what you just said. It will take, the therapy sessions are usually not a one-off session. It could go over like a 6 months period. It could go over like three minimum it's about 3 months, but it could go from 3 months to about a year, constantly teaching the individual to understand their symptoms, to understand the thoughts associated with those symptoms, and to also understand, thirdly, the behavior associated with the behavior also is equally important, because when people have panic attacks, maybe somebody experienced it while driving over Third Mainland Bridge, then they stop going on Third Mainland Bridge, and they feel that because I have not gone on Third Mainland Bridge, that's why I've not had any panic attack. Then one day they have the panic attack at home, they say, the thing has come home. So it's understanding that it's not, those behaviors tend to reinforce, the symptoms.
Okay, so I just want to ask, those statistics we spoke about,
yeah.
Are they similar in Nigeria?
Yes. Findings have shown over and over again that the prevalence are similar across the globe.
Thank you so much for coming. It's been a wonderful talk.
My pleasure.
So we can begin to catch more of the panic attacks now.
Hopefully.
Thank you, Morrison. Thank you, Akim, for being there. We've come to a close. Have a wonderful day. I am Mary Alale Yusuf.